Hi, everyone. Thanks for joining today. We're going to give folks about another minute or so to get logged in, and then we'll go ahead and get started with today's webinar. Hey, well, good afternoon, everyone. Welcome to today's webinar. My name is Melissa Kraus. I'm the Associate Director for our Corporate Relations team here at NACO. Thank you so much for joining us. Today's webinar, Rural Resilience and Strategic Responses to the Opioid Epidemic, will highlight how rural counties are leveraging available resources to build coordinated, sustainable opioid response strategies, how local leaders are strengthening partnerships, expanding prevention and recovery efforts, investing in measurable solutions, and will also share practical examples of what is working on the ground and how counties can have lasting with the resources available to them. We want this to be an engaging conversation, so please feel free to submit questions throughout the webinar using the Q&A button at the bottom of your screen. We'll have time at the end for some discussion, and we'll try to get to as many questions as possible. And now I'd like to turn it over to Leanne Slaughterbeck, Director for Stage Cares, who will share more about today's webinar and introduce our presenters.
Thank you, Melissa. Hello, everyone. We are excited to have you join us today for our webinar. Rural communities are often characterized by strong social ties, local innovation, and a deep commitment to supporting neighbors in times of need. At the same time, they face unique challenges in responding to the opioid epidemic, including limited access to care, healthcare workforce shortages, and transportation barriers. We are in a critical window where counties have the opportunity and can make strategic decisions that can save lives and strengthen communities. This webinar will highlight how rural counties are leveraging these resources to build coordinated, sustainable opioid response strategies. We're very excited to have three great speakers here with us today. Darci Graves brings more than 2 decades of experience spanning federal government, nonprofit, and academic settings with a particular focus on rural health and health equity. Katherine Perkins serves as a program officer with the CDC Foundation, supporting overdose prevention initiatives and strengthening partnerships between public health and public safety organizations. She works with community coalitions and cross-sector partners to develop evidence-based strategies that improve local overdose prevention and response efforts. Josh Speakman is the collector and treasurer for Stoddard County, Missouri. He brings firsthand experience managing public funds and investing in local abatement efforts that create measurable community impact. I'll hand it over to Darci now to share more information.
Thank you so much, Leanne, and thank you, NACO, for hosting this topic today. Good afternoon, everyone, or good morning if you're joining us from further west. I'm truly grateful to be here talking about this very important topic in these critically important communities. And I'm going to kick off today's discussion with a bit of an overview of the fact that we often know what the statistics are, but we don't always know who those represent. And that knowledge is key when we're trying to strategize our response in these communities. We know opioid overdoses have increased in both metropolitan and non-metropolitan communities, and we know that this impact is being felt across the country. We also know that access to treatment remains uneven, with many high-need rural counties facing limited prescribing capacity and rural residents reporting challenges accessing addiction treatment. More specifically, in one study, 75% of the farmers surveyed said it was easy to access large amounts of opioids without a prescription, while only 33% said it would be easy to access treatment. And when we look at those high-need counties, we can easily see the disparity in the prescribing capacity. But statistics can only tell us so much. Before we talk about solutions, and my esteemed panelists were going to do a great job at sharing what's working in these counties and communities, it's worth asking who our numbers represent when we're looking at statistics and what life looks like in the communities behind them. When we move on to the next slide, when we think about rural, what comes to mind? And if you were to Google rural America or ask AI, paint a picture of a rural community, it would probably come up with farms, maybe a small town, and predominantly white communities. But rural America is far more diverse and complex than those images suggest. One of the goals I had when I started working in rural many years ago was to help change the narrative. I grew very tired very early on of hearing every presentation or every speech that a politician or someone in the federal government was giving about how rural was older and sicker and sadder and poorer, and it just made it all sound all so doom and gloom. And while the data does show disparities, there's so much more. There's hope, there's creativity, there's so much passion for these communities that we can never undercut or underestimate them. Next slide. So who actually lives in rural communities? While rural America remains predominantly non-Hispanic white, the headline statistic doesn't tell the whole story because rural communities have become increasingly diverse over the past decade, and that diversity is especially visible when we look at children, suggesting that these communities are going to continue to evolve in the years ahead. But it's also important to remember that rural populations include millions of LGBTQ plus individuals, a higher proportion of veterans than metropolitan communities, tribal communities, immigrants, people with disparities and disabilities, and many others whose experiences are often overlooked in conversations when we just talk about rural health nationwide. The reason this matters is simple. When we talk about the opioid epidemic in rural America, we're not talking about a single population. We're talking about diverse people, families, and communities whose needs, strengths, and experiences may look different from one another. As people are prone to say, one rural community. If you've seen one rural community, you've seen one rural community. Next slide. And it's important to remember that we're not just talking about different people. Sometimes we're talking about different realities. Many of the challenges we associate with rural health are geographic, and rightly so. A specialist may be hours away. Public transportation may not exist. Broadband may be non-existent or unreliable at best. And in some communities, the local hospital may be operating on very thin margins or may have had to close altogether. One of my favorite examples is the sign in the lower circle on this slide. This is an admission slide at a hospital in Anchorage, Alaska, where it says admissions and Medicaid travel. And that tells us something important because accessing care isn't just about whether the services exist. It's also about whether people can physically get there. When I was doing this work, I would always say, if you have to get on a plane to go see your provider, that's a thing. And that's true in Alaska, Hawaii, South Dakota, or on the bottom of the Grand Canyon. These realities shape every aspect of health, including opioid prevention, treatment, and recovery. And the challenge isn't simply what services are available, it's how geography influences whether people can access and use them. On the next slide, it's important to think, when we think about the geographic isolation, that we think about distance, but it's also more than that. If we take a look at this bus stop in this photograph, the sign says weekdays only, which is fine until your treatment appointment is on a Saturday or your support group your recovery meeting is on a weekend. And functionally, then you no longer have access to those services. The same dynamic plays out across rural communities. A service may be technically available, but distance, transportation, broadband, workforce shortages, and social isolation can make it difficult to access. And these challenges can be even greater for people with multiple marginalized identities. If you don't have public transportation and have a disability, and all of those things, those compounding things can stand between you and recovery. Next slide. But again, not all doom and gloom, because when we center the people and we center the communities and we approach things through an asset-based approach, thinking about what strengths already exist, how do, who is there and what do they bring to the table? How do the multiple identities create unique needs? How does location compound or facilitate access? When we think about community engagement, who's missing from the table? Who else's voice needs to be there? And when it comes to policy coordination, how do we turn our silos into quilts? Next slide. As community leaders, practitioners, and partners, there are a few common traps that are worth avoiding. First, and this goes without saying, don't assume that a strategy that worked in an urban setting will automatically work in a rural one. The goal isn't to replicate programs. As with everything, it's about adapting them to the local realities. Second, resist the urge to treat rural communities as interchangeable. As I mentioned, one rural community does not equal another. Farming communities, tribal communities, mountain communities, a rural manufacturing town may all face opioid-related challenges, but the assets, barriers, and opportunities can look very different. Third, don't start with what's missing. Rural communities often have fewer resources, but they have strengths. They have figured out long ago how to do more with less. They have trusted relationships, strong community networks, local leadership, and deep knowledge of what will and likely won't work in their communities. And finally, don't build solutions for communities. Build them with communities. The people closest to the challenge are often closest to the solution. Next slide. What I hope you'll take away from this section as we enter into the how do you apply this sort of information and what these solutions look like in real time is that rural is often more diverse, complex, and resourceful than they're often portrayed or given credit to. The opioid epidemic may be national, but it's experienced locally. And we know that community context and existing assets all shape how challenges are experienced and how solutions take hold. So as you listen to Katherine and Josh as they talk, I encourage you to think about not just what was done, but why those approaches worked in those particular communities. Last slide, because I want to make sure that I leave you all with assets. I just want to mention 3 quick funding and resource opportunities. There's the Rural Communities Opioid Response Program out of HRSA, which is a federal agency. They offer funding grants for a host of different opioid use disorder issues in rural communities. I'm sure everyone at this point has heard about the Rural Health Transformation Program, which includes $50 billion to help states strengthen and stabilize rural health systems. States are doing, this is all down at the state level. So if you haven't connected who are working on these issues in your states, I encourage you to do so. And then there's the Rural Information Hub, or RHI Hub, which has a ton of great resources and starting points, offering data, tools, best practices, and a comprehensive rural funding and opportunities database that breaks things down. Many counties may also have access to opioid settlement funds and newer federal opportunities supporting behavioral health, EMS, and rural opioid response efforts. Just last week, HHS announced announcements included funding opportunities related to mental health addiction, homelessness, rural EMS training, and rural opioid technical assistance. So lots of opportunity, lots of resources. And I also included a slide of just possible organizations of interest to help connect dots. But with that, I will say thank you again and pass the microphone over to Katherine.
Thank you, Darci. I'm so glad that you talked about a strengths-based approach and making sure that you have the right people at the table, especially when it comes to rural communities. So I am pleased to be presenting today on a model that the CDC Foundation has created with opioid settlement funds to support rural coalitions as they build partnerships in order to address overdose in rural Georgia. I do want to thank our funders at the Georgia Opioid Crisis Abatement Trust for their support of this work. So the CDC Foundation is an independent nonprofit that helps the Centers for Disease Control and Prevention, or CDC, save and improve more lives by unleashing the power of collaboration to protect the health and safety of the world. We believe that groups, organizations, individuals have a greater positive impact and can accomplish more together. We have at the CDC Foundation, we have a number of other programs that are focused on overdose. I won't read every single one here, but I'd be happy to chat more after this webinar. Our programs really span across several systems, including work in overdose data sharing and translation, as well as evaluation, systems strengthening, prevention and response activities, partnership building, and youth prevention outreach. I would be happy to share more, like I said, after this webinar. Next slide, please. The CDC Foundation is the public health implementer for a program called the Overdose Response Strategy. ORS is a nationwide program that connects public health and public safety in order to address overdoses and emerging drug threats. We recognize that the overdose crisis requires a unified effort across sectors, and this program has worked for over a decade to bring these fields together. As a program, we have 61 teams of one public health person and one public safety person in all 50 states, as well as DC, Puerto Rico, and the US Virgin Islands. And these teams are implementing this program directly, but we also have a national coordination team and a team of technical advisors who provide that local tailored support. So this was the kind of model that we wanted to adapt to our local communities. We were able to leverage the expertise we gained from this program to adapt to rural Georgia. When we applied for opioid settlement funds, Georgia had 17.8 fatal overdoses for every 100,000 people. At the time, the national average was 24.3 per 100,000 people. However, we recognize that rural Georgia, which is 118 of Georgia's 159 counties, had a disproportionate rate of overdose deaths. You can see it here on the map in any darker blue colors. Rural counties had almost double the state's rate of overdose, with several counties almost 3 times the rate. Dodge County, which is in kind of south central Georgia in the darkest blue, had a rate of 50.9 fatal overdoses for every 100,000 people, which was the greatest in the state. I also want to point out that 68 of the state's counties had data suppression, which is included in some of the kind of white or gray counties listed on the map. We know that data suppression could indicate a low capacity to capture data accurately or completely. So given the significant burden of overdose in areas with limited centralized resources, we wanted to focus our work on rural counties and reviewed a subset of counties with the greatest need based on a number of things that you'll see here: overdose fatality rate, rate of hospital utilization, access to care, rurality, other gaps in the area. And we worked with all of our Georgia contacts, including our Georgia ORS public health analyst and our Georgia rural subject matter expert, in order to find a number of counties that we could reach out to for this work. Next slide. We designed our project to reach rural communities across the state in support of capacity building. We were really strategic in our outreach and our proposal review, recognizing that communities with the greatest need might not have the capacity to write the strongest grant application. We also acknowledge that many organizations may not have been aware of how settlement funds work or have recognized how they could apply for settlement funds to expand their existing work. We recognize that rural communities have unique strengths, as Darci said, particularly in strong relationships, innovative problem solving, and resourcefulness in using funds. material or knowledge. So we wanted to leverage these strengths, these skills, and use them to strengthen overdose prevention and response. So we built a project that is focused again on capacity building for a number of things, including providing evidence-based and effective services, understanding how overdose data can be used to inform action, coordinating work across public health and public safety, and building an infrastructure of local partners in order to sustain this work. Next slide. So this is a map of the 18 coalitions that we were able to fund by this grant. As you can see, they're pretty spread out across Georgia, but they do map on closely to the map of overdose burden on a previous slide. Most of our coalitions work individually in their own county, but some of them support multiple counties, as well as we have a few that do overlap, but they're providing different services if they're within the same county. And we have a number of organizations in this grant, including recovery community organizations, family connections, youth outreach, shelters. We've got healthcare providers, treatment providers, and community nonprofits. Most of these organizations are not Georgia specific, so they're likely doing this work already in your communities. Next slide. As you've heard me say, partnerships are really the key to magnifying the impact, which is especially important when we're talking about limited funding. Our coalitions work across sectors to implement stronger overdose prevention activities that they have defined as important in their local areas. Again, both Darci and I have shared it's really important that you are tailoring these to local communities, and we don't assume that what works on a national level or what works in other states will work in rural Georgia. Our coalitions leverage these partners that you see on the slide to do things like distribute naloxone or host naloxone access boxes in creative places, to address overdose and youth substance use prevention in school systems, to improve wraparound services like housing and transportation. It also includes recovery counseling or treatment. We also do a lot to support workforce development and provide compassion fatigue training for first responders, just as an example. Local officials are a really critical part of our community's work in preventing overdose. Local decision makers and leaders can help identify opportunities for innovation and resource sharing, especially again in rural communities. In rural Georgia, as I'm sure happens in many places, each county or locality experiences a different landscape of elected officials or leaders, especially as it relates to their support of activities that prevent or address overdose. Although overdose is a nonpartisan issue, we know that working with legislation and funding constraints is inherently political. Our coalitions in Georgia have been really consistent advocates for their work and have been able to translate the importance of their work to their local officials, and in turn have found some local champions who can help them establish legitimacy in their work. I wanted to share some examples of how our coalitions are working with their local officials. Some are doing things like finding additional housing units that they may not be aware of. Some are collaborating to understand where overdoses are happening in their community to make sure that resources are getting shared across all sectors in those kind of hotspots. Some of our coalitions are using their local officials to create post-overdose response teams, which are usually made up of many multi-sector partners like first responders, community organizations, recovery community, etc. Some of them are helping create new referral pathways. So a police department might not be talking to a mental health unit, but they can be the bridge in that referral network. And then importantly, local officials have that 10,000-foot view, and they can identify existing systems or gaps and make sure that we're not duplicating efforts. Our coalitions in rural Georgia have demonstrated their innovation and persistence in this work, and really, again, partnerships have been key to breaking silos in their work. Next slide. If you take one thing from my slides today, I want you to remember that although overdose is technically a public health emergency, it really requires support from all sectors. Our work intentionally brings together partners from every sector to pool resources and expertise across fields because we believe we can accomplish more together. Everyone can play a role in reducing overdoses. Next slide. So with that, I want to share a few resources for how you can follow up on this work or where you could seek technical assistance for implementing this work in your community. That's all I have. Thank you. And with that, I will pass it to Josh.
Hey, thanks, Catherine. I appreciate it. For those that don't know me, my name's Josh Speakman, and I serve in Missouri as the Stoddard County Collector and Treasurer. Before entering public office, though, I spent several years as a firefighter, a paramedic, and a flight paramedic. And throughout that career, let me digress though. When I generally don't say for many years or how long ago, I normally judge it in the amount of pounds. So 40 pounds ago, I was a firefighter. But throughout that career, I saw firsthand the impact of an opioid addiction, what it has on individuals, families, first responders, and entire communities. When opioid settlement funds began reaching our counties, here particularly in Stoddard County was presented with both an opportunity and what I felt like was a responsibility. The opportunity was to invest in programs that could truly make a difference. The responsibility was ensuring those funds were spent wisely, transparently for our taxpayers, and in a manner that will produce meaningful results. Next slide. That important responsibility led Stoddard County to Stage Cares. I was first introduced to Stage Cares while attending the annual conference at NACO in Philly, in fact. So just a shy of a year ago. Like many county officials, I was looking for ideas, resources, and partnerships that could help us maximize the impact of opioid settlement funding. During discussions, though, with other county leaders and organizations that were working in the opioid abatement space, I was introduced to Stage Cares and the services they were providing for counties all across the country. What immediately stood out to me was that they weren't simply helping counties spend money. They were helping counties answer important questions or questions that I felt that were important and Stoddard County felt was important. And those questions were like, are we investing in the right programs? Are we remaining compliant? Are we tracking the outcomes to measure that meaningful impact? Can we demonstrate accountability to our citizens, those that depend on us to make a difference in our community? And are we making that meaningful impact? Those are questions that every county really should be asking. The reality is that most counties don't have a dedicated opioid abatement department, particularly rural counties, of course. We all wear multiple hats. In Stoddard County, we wanted to make sure that we were simply receiving the fund. We weren't just simply receiving the funds and putting them into projects without really having a way to measure that success. We wanted to be intentional. Stage Cares provides Stoddard County particularly with those tools to track the revenues, the expenditures, program implementation, reporting requirements, and outcomes. Just as importantly, they helped us organize information in ways that allows county leadership to make informed decisions moving forward. So my working relationship between the treasurer's office here and the county commission being involved is Stage Cares really played a pivotal role in helping us to bridge that gap. Instead of simply asking, how much money have we spent? We can be asking, what difference did that money make? Next slide, please. Programs we've implemented here in Stoddard County, one that I'm proud of for Stoddard County, we didn't allow these funds just to sit idle. We worked to implement programs that address different aspects of opioid abatement. Sage Cares helped us track those efforts along the way. One of the programs, of course, I'm partial to this, is the Narcan box program as a paramedic, and I still practice some. One of the first initiatives we implemented was the placement of Narcan boxes throughout our community. So, and I don't mean the Narcan boxes and like the drug boxes that the drug comes in. It's kind of like an AED. AEDs are placed in public locations for cardiac emergencies. These boxes are placed similar and gives individuals access to Narcan, which is, as you all or many of you all know, is a medication to reverse opioid overdoses that saves lives. Like I said, as a former paramedic, I understand the importance of immediate intervention. Sometimes a few minutes can make all the difference increasing access to Narcan gives communities another tool to respond during an overdose emergency. So, fun fact there: whenever the ambulance district that I worked closely with on this put this out on Facebook that they were doing this, within the first hour. Now we're a rural community. We have 30,000 people in our county. Within the first hour, it had like over 150 shares, something along those lines. So it was a really popular program. We have a program called DARE here in Missouri, an opioid education program where the sheriff's office kind of implements. That was our second initiative that we really got involved in. That was opioid specific. Through the DARE program, education remains one of the most powerful prevention tools available. By incorporating opioid awareness in the youth education programs, we're helping young people understand the dangers of opioid misuses before they ever find themselves facing these decisions. Opioid abatement isn't only about responding to an addiction, it's about preventing the addiction. And then we did another program with a local church puts it on. It's a non-for-profit though. It's a women's recovery and rehabilitation center. And so we use that as our third initiative, involving supporting the local women's rehabilitation center with programs and funding focused specifically on opioid recovery. Recovery is a critical component of opioid abatement, while prevention with the DARE program and emergency response with the Narcan program are important. We also have to invest in helping individuals who are actively working to overcome that addiction. Now, this particular recovery centers specifically for women, we've looked at a other programs and trying to build some on top of that. But in Stoddard County, where we don't have a lot of funds that we can just throw out there, so our county's actually kind of helped out with our opioid funds. Programs that provide treatment, recovery support, and long-term stability can have lasting impacts, not only on individuals, but our families that we live here with and here in our community, live, work with, go to church with. Next slide, please. And you might ask, how has Stage Cares helped us here in Stoddard County? Stage Cares has been extremely valuable because it allows us to connect all these efforts together. They helped us track the funding. We can clearly see where the funds are going, the funds received, funds allocated, funds spent, program expenditures, maintain compliance. Anyone who has dealt with grant funding or settlement funding knows reporting requirements can be a little bit overwhelming, especially here in small town Missouri. Stage Care has helped us ensure we maintain the documentation and the records necessary to really remain compliant and accountable for the settlement, accountable to those that elected us to serve them. And we can measure the impact. This is probably the most important piece, in my opinion, as a paramedic and someone that was involved in that space and get to serve in that space in a different capacity now. It's really easy to spend the money, but it's harder to demonstrate the results. Stage Cares gives us the ability to track the program and evaluate outcomes so that we can make better decisions in the future. We can measure, what did this program have? What kind of impact did it have in our community? Was it successful? Was it mediocre? Did it underperform? And then we can reinvest to that moving forward. One of the things I enjoyed most about working with Stage Cares is the emphasis on collaboration. In fact, we recently hosted a county officials forum, group meeting, tabletop, if you will, here in Southeast Missouri at one of the best barbecue joints that you can go to. So you ever get a chance to visit Dexter, Missouri, Hickory Log, that was a fantastic place. And we got to discuss opioid abatement efforts, share ideas, and learn from one another. No county has all the answers, but by sharing success, the challenges, the lessons learned, and really that helps us to become better equipped to address the issue. And then the last slide there. Well, I believe this partnership matters. This partnership with CARES matters. This partnership with NACO matters. Our state affiliation matters. It's someone who spent really years working in emergency services. I've seen the consequences, and I've seen the addictions up close. One of my very good friends lost his life to opioid addiction. And now serving in local government, I have the opportunity to be a part of the solution just from a different perspective. And what I appreciate about Stage Cares is that they help bridge those two worlds. They help counties move beyond simply spending money and really towards creating a measurable impact. The opioid settlement funds represent a unique opportunity. We owe it to our citizens, to our future generations, to ensure that those dollars are used effectively. They're used responsibly and in ways that truly help people. That's exactly what we're striving to do here in Stoddard County. So in closing, I'll say, at the end of the day, opioid abatement isn't about spreadsheets. It's not about reports. It's not about dashboards. It's really about people. And I mean that sincerely. It's about preventing addictions before it starts. It's about helping someone survive an overdose. It's about supporting recovery when they found themselves in that hard place and giving individuals really a second chance. Uh, and it's about ensuring that every dollar entrusted to us as elected officials and county officials and state officials uh, is used in a way that creates a meaningful impact. I appreciate Stage Cares for helping Stoddard County stay organized, compliant, and focused on outcomes. And I appreciate all of you and the work that you're doing in your own communities. And so I have to give a special shout out to NACO for hosting this and letting me share my story here in Stoddard and the impact that it's had. So that's kind of all I have for everybody.
Thank you, Josh. It's exciting to hear the progress Stoddard County has been making. I'm grateful to all of our presenters today for sharing such impactful information. We now have about 10 minutes for questions, and if you would please utilize the Q&A feature to type in your questions for our speakers. We will gladly review those and answer those accordingly. If for some reason we are unable to answer all of the questions, we will share answers via email after today's call. All right, I'll give everyone a couple of minutes if there are any questions to come through. I'm not seeing them as of yet. Well, I'll add that you must all have done a fantastic job. All right, we do have one question that came through. This question can be answered by any one of the three. In your state, how did they set up the members of the oversight organization for funds? So if one of you would like to answer that.
Specific to the state or to the county? I mean, I'm a little lost in the sauce on the question.
Yeah,
I would say from the state perspective, I see it came through. I really don't have the answer to that. I'm not sure how our state here in the state of Missouri set that oversight up. I know how we did it here on a local level uh, with a survey going out and getting people involved in information, and then the treasurer's office and the commission working. But I'm not real sure from a state level. Unfortunately, sorry I couldn't answer that.
Yeah, unfortunately, I can't say for Georgia either. I do know there is an entire advisory board that the Georgia Opioid Crisis Abatement Trust has set up, but I'm not quite sure. I do have the website on my slide, and I do believe they have a list of who's on their advisory board, or if not, I'd be happy to answer that offline.
we've got a couple more questions coming through if one of you would like to grab one.
So here in Stoddard County, I'll read the question because I don't know if everyone can see or read the questions, but have any of you implemented mobile opioid treatment services for rural areas or the lack of transportation? If so, has it been effective? That's been some discussion. We here in Missouri, particularly Stoddard County, the local emergency services, the DAC-based service, and they have a community paramedic program. That was kind of something that we were looking at implementing, just working out all the fine details, but they were going to try to provide that service. I know in Stoddard County we have a lot of issues with transportation, particularly, I mean, we're And we're a rural county. We have 30,000 people, but we have 1,006 miles of county roads, not counting in-town mileage. That's just county roads. So I think it's the fifth or the seventh largest landmass county in the state, which I mean, there's quite a bit. So that's something that we've been looking into, but we haven't set it up, so I can't measure the success on it. I would assume though that it would be I'm kind of pushing for it, and I know EMS is pushing for it. I think it would be a successful tool here in Southeast Missouri.
I know there was another question that came in about how to address the transportation barrier, and I do think that's a $1 million question. We do have some community coalitions that were already providing transportation services for a really narrow service, like taking people from a shelter to a treatment or counseling session. And with additional funds, they've been able to expand that so that they are able to provide maybe not any transportation need in the county, but that they're able to meet broader needs for any of their participants. And then what I didn't get to say in my presentation is we tried to create a cohort across these coalitions. So especially where any coalitions were in similar geographies, if they can kind of share resources like sharing the transportation van, that's a great solution. We've been looking into ways to support that through other creative funding opportunities, but I'm open to suggestions if anyone has any.
It's okay with you, Leanne, Catherine, Darcy. I'll inject on this last question here or the one that just came through is what is the first step for rural counties to take in addressing the opioid crisis? And really, in my opinion, it is getting feedback from the community to see really where that crisis is, what area it is. One of the things that we did here in Stoddard County whenever we first teamed up with Stage Cares is we did help me with what is called there, Leanne. I don't want to call it a survey,
We did a needs assessment.
yeah, a needs assessment. There you go. Okay. See, that's why I'm not a professional in this space. I just helped implement the programs and put them all together, the pieces together. We did a needs assessment where we had, I mean, from funeral homes to school board members to local city council members to nurses and doctors and me as an elected official and as a paramedic and just several people giving feedback on what they felt like that need was. And then we spun programs off of what those needs. We did a spin off of what we felt like the top needs were from the professionals throughout the community, and it was a wide range from coroner to funeral home to, like I said, mental health, churches. We got a lot of information from a lot of folks, and then Stage helped put that together, and that's why we went with the Narcan boxes. And then, of course, I'm a big proponent of education. That's why we went with the DARE program because, education is going to have those long-term impacts uh, in opioid abatement space.
Absolutely. I just want to second a couple of the things or underscore a couple of the things that Josh said. One is, the first thing is understanding what, where the issues are, what the issues are. And so doing that outreach to the community. But in addition to a needs assessment, also doing a bit of in public health, I would call it a resource inventory. And it's looking at what assets, what strengths does the community already have? Do you have a clinic? Do you have a school? Do you have a program that could, be amended to include some DARE education aspects? What are the faith-based communities? What are those places where people gather? Is it a public library? Is it a community center? And those sorts of things. And making sure that that is part of the considerations when you're doing the needs assessment and then seeing where those gaps are so that you can use your dollars efficiently and meet the needs of the community where they are at all those steps. Because again, I want to underscore what Josh did, and I don't know if he did it intentionally, but he essentially described the entire continuum of making sure you have education so that you can do the prevention, make sure you have access to the treatment so that people who are in current crisis can get the help they need, but then continuing to support people in recovery so that you're covering the full spectrum of what people who are going through addiction need. And then, and using other case studies, maybe your community used to have a substance use disorder issue and now it has the opioid use disorder. What lessons learned can you apply across those spectrums? So chances are you have a lot of this information at your fingertips. It just hasn't been collated or looked at in a comprehensive way. And that's what I believe Staged Cares can help with, but that's also how I would start is what does the universe look like? And then how do you act on it?
I really love that. I completely agree. And I think a lot of where communities can start in addressing this is like both Darci and Josh were saying, understand your community's landscape and make sure you have everyone at the table. I mean, like I said, we know that overdose is a bipartisan issue. That doesn't mean that it's not political or that it's not difficult to address, but really making sure, since it touches every sector, that you have someone from every sector able to give their voice, and that includes people with lived or living experience, making sure they can share directly, tangibly what would be effective in your community. So, and then the other thing I would say is know where you're going for your kind of technical assistance or knowledge, if you will. There's countless resources out there that we've shared in our presentation. We're happy to follow up with after the fact for what is effective, what's the best use of funds. If you have limited funds, what's going to carry the dollars the furthest. I will point out the Johns Hopkins opioid settlement principles does have a great starting point for what to do if you have, specifically if you have funds to address this. But I think get the right people in the room as well, and find your local champions if you're not able to get everyone in there.
All right. Thank you, everyone, for submitting your questions. Unfortunately, we are at the end of our time. I'd like to thank NACO for partnering with us to host today's webinar. Please also join me in thanking our outstanding presenters for sharing their expertise and experiences with us today. We're grateful to all of you for joining us and for your ongoing efforts to implement opioid abatement programs that make measurable impacts and save lives. Before we wrap up, I'd like to leave you with one final update. Over the past 2 years, Staged Cares has had the opportunity to learn from counties across the country, including many rural communities. Those conversations have helped us better understand the unique challenges you face and how we can better support your work. As a result, we now offer 3 Staged Cares packages, giving counties the flexibility to choose the solution that best fits their needs, goals, and budget. I'd love the opportunity to talk with you about those new options. If you will be at the 2026 NACO Annual Conference next month, please stop by booth 536 to say hello, or simply scan the QR code to connect with us today. Thank you again for joining us. I hope to see many of you at the conference next week, and I look forward to continuing the conversation. Thank you very much.